Kidney stones are one of the most common and intensely painful conditions encountered in urological practice, yet many cases can be handled effectively without any surgery at all. Have you ever wondered why a tiny mineral deposit no larger than a grain of sand can cause such severe agony? Or what if there were reliable ways to manage and eliminate these stones using nothing more than your body's natural systems and gentle external energy? Stop for a moment and picture waking up with that sharp, familiar pain in your side, only to discover that effective, non-invasive solutions are readily available and can often resolve the issue without hospital stays or incisions. Did you know that thousands of patients every year successfully clear kidney stones through smart hydration and advanced sound wave technology, avoiding traditional surgery entirely? What if the path to relief was far simpler and less frightening than most people assume? Today we explore the world of non-surgical approaches to kidney stones in depth, uncovering how these methods work, when they are most effective, and why they offer such a reassuring option for patients. Non-surgical management generally revolves around two powerful pillars. The first is hydration, which encourages stones to pass naturally through urine. The second is a highly refined outpatient procedure that breaks larger stones into tiny, passable fragments using targeted sound waves. This procedure is known as ESWL, or extracorporeal shockwave lithotripsy. Small kidney stones, typically those measuring up to 4 millimeters, often respond beautifully to hydrotherapy alone. Imagine simply increasing your daily water intake to 2 or 3 liters or more, creating a steady flushing effect in your urinary tract. Did you know that many of these smaller stones will eventually pass on their own with consistent hydration, carried out gently in the urine without needing any medical intervention? It is a process that relies on patience, proper fluid balance, and sometimes a bit of natural luck. The increased volume of urine helps dilute minerals and promotes the natural movement that can dislodge and expel the stone over time. Patients who commit to this approach often experience smoother outcomes and may even reduce their risk of new stones forming in the future. A common question that patients ask is whether any tablets or medications can force the stones out. The honest answer is that there are currently no reliable oral medications designed specifically to expel stones while they remain inside the kidney. Stop and consider the anatomical reasons behind this. Once a stone has moved into the ureter, the narrow tube connecting the kidney to the bladder, certain medications can help relax the muscles and ease passage. But inside the kidney itself, hydration remains the main natural strategy. What if something as simple as drinking more water became your most effective first-line defense? The process often involves an element of unpredictability. A stone might sit quietly for weeks or months before suddenly beginning its journey during a period of strong hydration. This randomness is precisely why doctors emphasize steady daily habits instead of waiting for symptoms to escalate. When stones grow larger, typically beyond 4 to 5 millimeters, such as 6, 7, 8, or even 9 millimeters, additional support becomes necessary. This is where the remarkable technology of shockwave lithotripsy comes into play. Did you know it is possible to break these stones apart from outside the body using focused sound waves, allowing the resulting small pieces or even powder-like fragments to exit naturally through the urine? ESWL has transformed care for suitable stones by offering a truly non-invasive solution. There are no cuts on the skin, no general anesthesia is usually required, and most patients are not admitted to the hospital. They can go home shortly after the session, which typically lasts only 30 to 40 minutes. What if modern medicine could target and fragment a stone while you simply lie comfortably on a treatment table? Let me walk you through how this fascinating procedure actually unfolds to spark your curiosity. The patient lies on a specialized table while a machine generates high-energy shock waves from behind. These acoustic pulses travel safely through the skin and body tissues, focusing precisely on the stone with the guidance of real-time ultrasound or X-ray imaging. The concentrated energy creates controlled pressure changes that crack and fragment the stone's crystalline structure into much smaller pieces. It feels almost like science fiction, yet it is a well-established, safe, and refined medical technique. Many patients mistakenly refer to this as laser treatment, but that is not accurate. This is shockwave lithotripsy or sound wave therapy. Knowing the correct name helps set realistic expectations and reduces confusion. This is not a laser procedure. After the session, the focus shifts to helping your body clear the broken material. Patients are encouraged to drink plenty of water to flush out the fragments. Some may experience mild discomfort as the pieces begin to move, but this is usually manageable with simple pain relief if needed. Most people do not require strong painkillers at all. Doctors may also prescribe supportive medications that help relax the urinary tract and promote smoother passage of the fragments. An important follow-up step is scheduling an ultrasound scan about 8 to 10 days later. This imaging check reveals how well the stone has broken down. If the pieces are now only 1 to 2 millimeters in size or have been reduced to a fine powder, no further treatment is typically needed. Nature can then complete the job as the remnants gradually exit the body. However, if larger fragments remain, the procedure can be safely repeated. Did you know that this flexible, stepwise method allows many patients to achieve excellent clearance while still completely avoiding invasive surgery? The benefits of these non-surgical options go well beyond mere convenience. Kidney stones affect millions of people worldwide each year, with risk factors including dehydration, diet, genetics, obesity, and climate. What if addressing the current stone also created opportunities to prevent future episodes through better habits? While we focus primarily on active treatment here, lifestyle factors such as balanced nutrition, reduced salt intake, and maintaining good hydration play important supporting roles in long-term management. Stone composition matters too. Calcium oxalate stones are very common, but other varieties exist, and imaging helps guide the most appropriate approach. ESWL tends to work particularly well for stones in the 5 to 10 millimeter range when they are located in favorable positions inside the kidney. Consider the real-life experience of a typical patient. Someone leading a busy life discovers they have a 7 millimeter stone and feels anxious about time away from work or family. With ESWL, they can undergo treatment as an outpatient, return home the same day, and resume most normal activities relatively quickly. The technology behind shockwave lithotripsy is itself quite remarkable. It draws from observations in industrial settings and has been carefully adapted and refined over decades for medical safety and precision. Success rates depend on factors like stone size, density, location, and patient anatomy, but many people see significant fragmentation after just 1 or 2 sessions. What if more individuals realize they have access to such elegant, minimally disruptive solutions? It is natural to have questions and concerns about the process. During the procedure, most patients describe the sensation as tolerable rhythmic tapping or pressure rather than sharp pain, and comfort measures such as mild oral or injectable pain relief are available if needed. Temporary side effects can include mild bruising on the skin, small amounts of blood in the urine, or brief discomfort while fragments pass, but these are generally short-lived and well tolerated. Serious complications are uncommon when the procedure is performed by experienced professionals. Individual assessment is always essential. Not every stone is perfectly suited for ESWL. Factors such as body size, bowel gas, or difficult stone location may lead to other recommendations. Yet for the right candidates, it provides an outstanding balance of effectiveness and minimal invasiveness. Hydration remains a vital partner both before and after treatment, accelerating fragment clearance and supporting overall kidney function. Let's explore hydration on a deeper level because its impact is often underestimated. Drinking higher volumes of fluid increases urine output, dilutes stone-forming minerals, and stimulates the natural muscular waves that move urine through the system. For small stones, this creates conditions where passage can occur more smoothly and with less pain. After lithotripsy, good hydration ensures that the newly created fragments do not remain in place long enough to cause blockages or new growth. Follow-up imaging offers reassurance and clear direction on whether additional sessions might help. Patients who actively participate in their care, asking detailed questions about their specific stone characteristics, expected timelines, and prevention strategies, tend to feel more empowered and achieve better results. Several myths surround kidney stone treatment that deserve clarification. Some people believe every stone requires immediate aggressive intervention, yet many small ones can be observed safely with hydration alone. Others assume all stone-breaking methods involve lasers or invasive surgery, but shockwave lithotripsy is distinctly external and non-surgical. Recovery is usually rapid, with most individuals returning to work and daily routines within a short time. As fragments pass, they may appear as fine gravel or sand in the urine, a positive sign of progress rather than a setback. Keeping in close contact with your doctor and tracking symptoms ensures the journey remains smooth and well supported. Long-term urinary and kidney health adds another valuable dimension to this conversation. Recurrent stones are unfortunately common without preventive steps, so investigating underlying causes such as metabolic imbalances or dietary patterns can be highly beneficial. Some patients gain significant advantages from personalized dietary guidance or medications that alter urine chemistry to discourage new stone formation. Increasing citrate levels through certain fruits or supplements, moderating animal protein, and maintaining consistent hydration are practical strategies that complement non-surgical treatments. Integrating these elements creates a truly comprehensive plan. Non-surgical management invites you to become an active participant in your own wellness rather than a passive recipient of care. The precision of contemporary shockwave machines continues to improve. Energy is focused tightly on the stone while sparing surrounding tissues as much as possible. Advanced centers often use dual imaging systems combining ultrasound and fluoroscopy for even greater accuracy. Sessions remain efficient outpatient experiences, often completed within an hour, including preparation and recovery. When you compare this to older surgical techniques that required incisions and lengthy healing periods, the advantages of today's non-invasive options become strikingly clear. What if future advancements make these treatments even more comfortable and effective? For now, ESWL stands as a trusted, proven cornerstone in the non-surgical toolkit for kidney stones. In summary, non-surgical approaches to kidney stones represent a beautiful blend of nature's simplicity and cutting-edge technology. From consistent hydration that empowers small stones to pass on their own to sound wave lithotripsy that safely fragments larger ones, patients today have powerful, patient-friendly choices that minimize disruption to daily life. Did you know that embracing these methods frequently leads to faster relief, lower overall healthcare costs, and significantly greater peace of mind? Stop imagining worst-case surgical scenarios and start considering how informed choices and the right strategy can transform your entire experience with kidney stones. These insights have already helped millions of people worldwide navigate this common condition with confidence. Whether you are dealing with a small stone that may resolve through fluids or a larger one well-suited for lithotripsy, understanding your options is incredibly empowering. Always consult your urologist for advice tailored to your specific situation, as every case varies based on stone size, location, composition, and individual health factors. Stay curious about your body, maintain excellent hydration, and approach kidney stones with informed optimism. What once felt like an overwhelming crisis can become a manageable and temporary chapter, overcome through science, patience, and the body's remarkable capacity for healing and clearance. With the right non-surgical plan in place, comfort and normalcy can return sooner than you might expect, allowing you to focus on living fully rather than on discomfort.